This is Health Assessment 3310. We are going to do a head-to-toe assessment just so that you have an idea about what it is that we expect from you on final checkoff day. We're going to assume already that the patient that we're seeing is here just for an annual physical, that we have already done his vital signs and have recorded them. But make sure that you are prepared to do your vital signs when you come in the day for checkoffs. Okay. Brian, Dr. Outlaw.
Nice to meet you.
Nice to meet you too. I know you're in here for just a regular physical today, right?
Right.
Any problems or anything?
Nope.
Okay. All right. Well, this is rather an extensive assessment, so it's going to take us probably about 30 to 40 minutes. Okay. I'm going to be asking you to do several different tests, and we're going to be going through some different exercises. And if at any time that you feel uncomfortable or that you have that you're not able to do anything, make sure that you let me know and I'll stop.
Okay.
Okay. All right. So the first thing I'm going to do is I just want to look at your skin. Okay. I'm looking at the color of it, the vascularity of it. I want to check your skin fur. Look like you're well hydrated. Okay. You have really vascular skin, probably because of your being so physically active. And look at your hands and your nails. Your capillary refill is less than 3 seconds. I don't see any kind of clubbing. What I want you to do for me, Brian, is I want you to put your index fingers together for me like this. Okay, hold them up for me so that I can see them. Okay, so that they touch for me. There we go. Okay, that's called a Shamrock test. What we're checking for is we're looking at the angle of your nails, and yours are fine. They should be less than 160 degrees, so yours look just fine. Okay, the next thing I want to do is I want to look at your head and your scalp. I'm looking at the contour of your head, looking at your hair in general. You don't have a lot of hair up there, so keep it short, which is good. All right, so I'm just inspecting it, looking for any kind of lesions, any abnormalities, anything like that. I want to look at the texture of it, the luster, I know the color, whether or not that you have any absence or excess. It's very evenly distributed. So I want to palpate your skull. You feel any kind of tenderness or pain when I do that, Brian?
No, it feels pretty good, actually.
Okay, all right. Most people tell us that. I don't see anything as far as any kind of flaking or no scalp problems or anything like that, right?
Right.
Okay, all right. So we kind of looked at your skin, at your hair, and at your nails. Now we want to look at your head, your neck, and your face. Looking at your face, I can see that there are 2 eyes, of course, that are evenly placed, symmetrical. Your nose, your ears are symmetrical as well. Notice that you have facial hair that's also evenly distributed. I want to go ahead and I want to palpate your face. Any kind of pain or anything like that?
Nope.
All right, I want to palpate your frontal and your maxillary sinuses. Any pain with that? Okay. If you did have a sinus infection, it would be uncomfortable when I palpated you right there. Okay. All right. We'll look at your neck. Looking at your shoulders, they're even height. Okay. I want you to, if you will, I want you to shrug your shoulders for me. Okay. That's actually assessing cranial nerve number 11, which is your accessory nerve. So it's fine. Go ahead and I want to see you swallow. Just take a sit for me and put your head back when you swallow so that I can see your trachea move. Okay. All right. That is also assessing cranial nerve number 10, which is your vagus nerve. Okay. Now I want to palpate your trachea. Kind of pain or anything like that? Okay. All right. I want to assess your thyroid, make sure that there's not any enlargement or any tenderness with it. So what I want you to do for me is I want you to take a sip of water and hold it in your mouth. And I'm going to give you some directions about how to hold your head. And then when I ask you to, I want you to swallow for me. Okay. And I'm going to kind of stand behind you. Okay. I need you to put your head down and to the right for me. Okay. All right. Now what I need you to do is swallow. Okay. All right. Can you do that for me one more time and then put it to the opposite side? Very good. Okay. Now I'm going to listen to your thyroid just to make sure that you don't have any bruise. Bruise is just bruise just means that you have increased blood flow to that area.
Okay.
Could be also indicative of a abnormal thyroid. Okay. gonna go ahead and I'm gonna palpate your carotids. Do them one at a time because I don't want you passing out on me. Okay. And while I'm here, I'm gonna go ahead and do your temporals as well. Okay, that's good. Okay. I am going to palpate your lymph nodes. It's not abnormal to have some lymph nodes that are enlarged, but you haven't noticed any changes, any discomfort from any lately? Okay. All right. These are your preauricular, your postauricular, your occipital, your retropharyngeal, your submaxillary, your submental. Okay, and if you will, turn your head for me this way, kind of tilt it to the side. It's your sternocleidomastoid muscle, and underneath this are your deep cervical chain. Okay, in front of this is your anterior cervical chain, your posterior cervical chain. Okay, once you go on the other side, so turn the other way for me. Okay, don't feel anything. Okay. And then I'm going to feel above your clavicles for your supraclavicular. Not a whole lot of room in there, Brian. And then below them for your infraclavicular. Okay. All right. Okay. Let's move on and look at. Let's go ahead and look at your ears. Don't do anything else. All I want to do is just look at them so that before that they're evenly placed. That outside of your canthus lines up to the top of your ear. I want to palpate them. Any tenderness or pain with that?
No.
Okay. I also want to palpate your tragus. Okay. Now I want to look at the inside of your ears with this otoscope. What I need you to do for me is, if you will, tilt your head slightly to the side. There we go. Okay. I'm going to pull up and back. Insert. Ooh, perfect. Pearly gray, absolutely beautiful. Okay, now we're going to look at this other side, so if you'll just tilt to the other side for me. I'll pull up and back again. Very nice. Okay. All right. We've looked in your ears. Now what I want to do is a couple tests just to determine whether or not that you've had any hearing loss. Do you have any problems hearing, Brian?
No.
Okay. I'm going to do a couple tests. One is called the Weber test. And what I'm going to do is I'm going to strike this tuning fork and I'm going to set it in the middle of your head. And I want you just to tell me whether or not that you can hear it equally in both ears, or whether you hear it in one ear more than in the other, and which one you do hear it more in, if you do.
Okay.
Does that make sense? Okay.
Yeah,
All right. All right. Here we go.
See.
Okay. All right. Now this one is checking your bone conduction versus air conduction. In individuals that have normal hearing, you should be able to hear sound twice as long from your ears for air conduction as you do on the bone. So we're going to first, I'm going to strike the tuning fork again. I'm going to put it on the mastoid process behind your ear. And when you stop feeling it, I want you to tell me that you can't feel it anymore. Then I'm going to move it to the front of your ear, and then I want you to tell me when you stop hearing it.
Okay.
Okay? Okay, 7 and 25, so you're really good hearing on that side. Okay, so we're going to do this other side.
Okay. Okay.
12 and 18. A little bit different, but it's just fine. Okay. Now I want to check your balance. I want to make sure that you don't have any problems with equilibrium, so I'm going to get you to stand up for me. Okay. While I'm checking your bounce, I'm also going to assess cranial nerve number 8, which is called your vestibular-coccygeal nerve. Okay. So what I want you to do for me is I want you to put your hands out to the sides, like so, and I want you to close your eyes, and I want you to lift one foot up. Okay. That's okay. Go ahead. Lift one foot up one more time. Okay. Now put down. Okay. Now the other foot. All right, very good, very normal. A slight amount of swaying is always okay, so it's really not a big deal. Okay, all right, I'm going to get you to sit back down. I'm going to look at your nose and I'm going to look at your mouth next. While I'm looking at your nose, I already told you that it was centered, it's midline. Don't see, doesn't look like you've ever broken it or anything like that. Well, they did a good job repairing it then. Any problems with sinuses or allergies or anything? Okay. Never had a deviated septum or anything like that? You have? Okay.
Yeah, you can still tell it's set a little more on the left side.
Okay, all right. So what I want you to do is just tilt your head back for me, okay? Well, before I have you do that, I'm sorry, let me just feel. Okay. All right, now I'm gonna have you tilt your head back, and I'm just gonna look. Oh, you definitely can tell.
Mm-hmm.
Wow, yeah, okay. All right, so, but no problems with being able to breathe or anything like that?
No, it's not anything that gives me any problems.
All right, good deal. Okay, now the next thing that I want to do is I want to check to make sure that because you've had that happen, I want to make sure that there's no problems with being able to smell. Okay, so what I'm going to do is I'm going to include one side of your nares, and I want you just to breathe out gently, and then I'm going to include the other side and do the same thing. Okay. I'm include this side. Okay. Do this side. Okay. Now, the next thing I want to do is I want to actually check that smell. Okay, so I need you to close your eyes. Okay, and I want you just to tell me what you smell. I'm going to include this nostril. Just take a sniff. Can you smell it?
Can't tell what it is though.
Try it one more time.
Yeah, I couldn't tell how strong
It's hard
it
to,
was.
yeah, okay. All right, vanilla, you're right. Okay, let's try the other side. Okay, I'll include this one. Smell that one so you can determine that one.
Something.
All right. Okay, well that's good. And I'm gonna try to pick things that you would know. Vanilla, cinnamon, cooking things.
Maybe chocolate cookies.
I should have got that, okay. All right, next thing we're gonna look at is your mouth. Okay, so the first thing I'm looking at is I'm looking at the condition of your lips. They're not chapped, there's no, you don't have any fissures in the corners, there's no lesions, nothing like that. So I'm gonna palpate them. So let me gently touch. Okay. All right. Now I wanna look at the inside of your mouth. Okay, if you just open real wide for me. Okay. I'm just looking at your throat, at your pharynx. Okay, can you swallow for me? Okay, see your, it's really hard to see your uvula actually. Okay, I want to look at your Stinsons and your Wharton's ducts. Your Stinsons, if you, I'm just going to put this right here. I'm just going to look on the very top, right here. I'm going to look at this side, sorry. Okay, and if you'll put your tongue up to the roof of your mouth for me. Okay, all right. Okay, and we'll look at the hard and soft palate. I think it's intact. Okay, very good. All right. Now, I'm going to check your gag reflex. Look forward for me a little bit. Can you tilt your head down just a little bit? Okay. Promise I'll be gentle. Well, that's pretty good, right? All right. Actually, that also assesses cranial nerve number 10, your vagus nerve, watching the uvula go up and down, as well as the gag reflex. Now, what I want to do is, well, you know what, I forgot to check your teeth. Let me just make sure. No problems. I noticed, wow, no cavities. Very good. You look like you got sealants. You have sealants on your teeth? Do they do that to prevent you from getting cavities?
Got a couple of kernels.
Really good. Okay.
And a broken.
All right. Now, the last thing that I want to do, and I'm going to be honest with you, most people don't like this very much, is I'm going to get you to stick your tongue out. First, I want you to stick your tongue out and just stick it out and just move it from side to side for me. Okay. All right.
So I get to lick the gauze.
Do what?
I get to lick that gauze. nails.
Absolutely. Well, you don't get to lick it. I'm gonna but I'm gonna place it on your tongue. I'm sorry. That is actually sticking your tongue out from side to side. And if you will, before we do this, push your tongue on the inside against my fingers on this side. Okay, that's just checking your tongue strength, and that is assessing cranial nerve number 12, which is your hypoglossal nerve. Okay. All right. So now I want to look at your tongue. So stick it back out for me. Okay, I'm just going to look at the underside. The reason that we look at the underside is because this is the most common place for oral cancer. So I always want to look at that. All right. Okay, so we're good with that. Okay, moving on. We're going to do a taste test. I know you're going to enjoy this.
Sure.
It's not too bad. What I want you to do is, every area of your tongue has certain taste buds. Okay, so what I'm going to do is I'm going to have you close your eyes, and I'm going to put different flavors on 4 different areas of your mouth, and I want you to tell me what you're tasting. You don't have to tell me specifically what it is. I just want you to tell me if you taste sweet, salty, bitter, or sour. Okay? All right. So go ahead and close your eyes. Trying to make sure that I'm not getting too much of the... Okay, all right, stick your tongue out for me. Okay, I'm just you can put it back in and just taste it. How does it taste?
Sorry.
Okay, all right, very good. You want to sit? I'm sorry. Okay, all right. I'm sorry about that.
That's fine.
See, okay, all right. I promise them that's the worst one.
Hang on a minute. It's just salty.
Okay. Okay, so you're tongue back out for me. Close your eyes, good. Okay, I'll try that one.
Sweet.
Okay, very good. That is assessing cranial nerve number 7, which is your facial nerve. Now we're going to assess cranial nerve number 9, which is your glossopharyngeal, and we're going to assess the last 2 flavors. Okay. So take your tongue back out for me. See if you can.
Sour.
Okay, good. And then one more. And then you just stick your tongue way out for this one because it's in the very, very back of your throat. Okay.
Definitely bitter.
Okay. Very good, Brian. Okay. All right. So I apologize. I know that was probably the least part that you liked. All right. Now we're going to move on to your eyes. Okay. So let me get rid of this real quick. All right. When you first got here, where's my garbage can go? Let's put it right here. When you first got here, we went ahead and we assessed your eyes using the Snellen chart, and your eyes were 20/20 in both eyes as well as in your right and your left eye. So you have really good vision. I want to, while I'm thinking about it, what? 15, well, okay. I want you to, if you will, just hold this at an easy length for you, and I want you just to read the first 2 lines of that for me.
Absorption rate. Measures how quickly a suture is absorbed or broken down by the body. Refers only to the presence or absence of suture material and not to the amount of strength remaining in the suture.
Outstanding. Okay, that is actually assessing the other part of assessing cranial nerve number 2, which is your optic nerve. Okay. All right, so now we're going to do a couple of the tests. I want to just look at your eyes first. So if you just look straight ahead for me, let me get one that works a little better. So I'm going to have you look straight ahead for me, and I'm just looking at your eyes. I'm looking at the shape of them. I'm looking to make sure that they're clear. I'm not seeing any deviation in them. Both sides. Okay. Step right in front of you. Your pupils are equal. They're round. They definitely react to light. Okay. What I want you to do now is we're going to check for accommodation. When you look from very close up to far away to back again, your eyes should very smoothly converge on whatever you're looking at without having any kind of jumping or anything like that. So I want to make sure that your accommodation is intact. Okay? So I'm going to have you just look at this for me. And now I want you to look at something behind me on the opposite wall. Okay, now look back at this. Very good. Okay, all right, so they look just fine. All right, there's a few other tests that we want to check. We're going to check your visual fields in just a second, but first I want to check your ocular motor muscles. This is actually going to assess 3 different cranial nerves. It assesses 3, 4, and 6. Okay, so that's your ocular motor, your trochlear, and your abducens. Okay, so the first thing I want to do is just look straight ahead. And I'm just going to shine this on the bridge of your nose. This is called a corneal light reflex, and I should be able to see these sparkle in the same place in both of your eyes, which I do. Okay, now I want to check your eyes for lazy eye. So I'm going to have you just look straight ahead at this. Okay. Okay, to the other side. Just keep looking straight ahead. Good. Now, if you have lazy eye or some form of it, when I covered up the eye and removed it, that eye would have either drifted outward or inward. Okay, and yours would just fine. Okay. I also want to do another test for your extraocular movements is called the H test. So what I want you to do is I want you just to follow my finger. Don't turn your head or anything like that. Just follow my finger with your eyes. Okay? All right? Good. All right. Very good. All right. I think you can probably stay sitting there if you were at just the right height. I also want to check your peripheral vision. Okay, this is called your visual fields. Now this is a little bit tricky sometimes. So what we're going to do is I'm going to have you cover up an eye, and I'm going to cover up the same eye. And I want you to, when you see my fingers, when you see them wiggling, I want you to tell me. All right, don't look out at my fingers, just look me straight in the eyes while we're doing that. Okay, all right, so cover up your left eye for me. Okay, I'm going to cover up my right eye to begin with. Okay? And I want you just to tell me as soon as you see them.
Yep.
Okay, now keep your hand there, and I'm going to move mine, and I want you to do the same thing. Tell me when you see them.
Okay. Yep. Yep.
Keep your eyes ahead. All right, now switch eyes. Use your other hand. There we go.
Yep.
There we go. Okay, all right, same thing. I'll do it one more time. Look me straight in the eyes.
I see it.
Okay.
Yep. Yep.
Okay, keep that hand there.
Yep. Yep. Yep.
Good. Your peripheral vision is intact as well, so good job. Okay. All right, so that was 3, 4, and 6 as far as cranial nerves are concerned. One last test that we need to do is called direct and consensual. Direct and consensual is when I shine a bright light into your eyes. The eye that does not have the bright light shining into it should do what we call consent, and it should constrict as well. So you want to make sure that they both do that. Okay, so I'm just going to separate them, shine a bright light here. Good. On this side. Very good. Okay. All right. Okay, Brian, next thing that we want to do is we're going to look at your thorax. Okay, so we want to listen to your lungs. I want to make sure that I don't hear any kind of fluid. Do you have any respiratory problems at all?
No.
Do you smoke?
No.
Outstanding. Okay.
No.
All right. So I'm going to get you to stand up for me. Okay. First, I just want to inspect. Okay. I'm looking at your chest, and we look at your thorax, and what I'm looking at is I'm looking at the anterior to posterior ratio versus your transverse. And from front to back, or your anterior to posterior, you should be once, as your transverse should be twice. You should be twice as wide as you are thick. Okay, and you are, so that's good. All right, so I'm going to get you to, if you will, come stand up here for me so you can see this. All right. What I'm going to do is I really just want to look. I'm going to palpate. So I want you to tell me whether or not that you have any kind of pain or any tenderness.
No, you roll a little harder.
No, I can roll a little harder. You have a lot of musculature back here, so it's really easy to feel the appropriate spots for being able to palpate. All right, what I'm going to do now is I want to make sure that you have what we call even symmetrical expansion, so that your lungs are rising and falling at the same time. So I'm going to put my hands at the base of your back, and I'm going to pinch up just a little bit of skin, and what I want you to do is take a deep breath for me. Okay, and let it out. Very good. Okay. They both fall at the same time. If you had a collapsed lung, or if you had a pneumothorax, one of these would not rise at the same rate as the other one. Okay? All right. Now I'm going to do what's called tactile lymphomyelitis. So what I'm going to do is I'm going to place my hands on your back, and every time that you feel me place my hands on your back, I want you to say the number 99. Okay? All right?
99.
Okay, very good. All right, now I'm going to percuss. Sound good. Okay. Now we want to auscultate. Just meaning that I'm going to listen to your lungs. Okay, so you have breath sounds, different breath sounds in the front than you do in the back. In the front you have your tracheal breath sounds right here, and you have your bronchial. Okay, your bronchial vesicular right here, and then everything else is vesicular. Okay, all right. In the back, you're going to have exactly the same breath sounds, except that of course you're not going to have any tracheal breath sounds. Okay, so we're going to listen to them using the diaphragm. Okay, what I want you to do, Brian, is I want you to breathe normally, but I want you to breathe just a little bit deeper than you normally would. Not real deep, because I don't want you to get lightheaded or anything. Just a touch, a touch deeper than you would. And if you do start to feel lightheaded, let me know, okay? And then I'll stop. Okay, go ahead. Okay, very good. All right, I'm going to check one more thing. This test is actually called bronchophony, and you're going to say the number 99 for me again, but this time you're going to do it every single time that you feel my stethoscope touch your back. And this is also just checking for fluid or any kind of consolidation in your lungs, okay? Very good. If you would have had fluid or consolidation anywhere in your lungs, that would have been very clear to me. But it was very muffled, so that's good. Okay, now we're going to move on to your heart and your abdomen. So I'm going to get you to sit on the table, and I'm actually going to get you to lay back. I'm going to get you to lay back without letting your things down first. Okay. All right? Mm-hmm. Okay. Okay. So the first thing that I'm going to do, Brian, is I'm going to get down here so that I'm eye level with your chest. You put your hands at your side for me. I'm sorry. And what I'm looking at is I'm looking at the configuration of your chest. I'm looking for any kind of pulsations or abnormalities, which I do not see. So I'm going to go ahead and I'm going to palpate your chest. No pain, no tenderness, anything like that. Okay. All right. Now what I'm going to do is I'm going to go ahead and I'm going to mark your heart valves. I'm going to listen to your lung sounds, or I mean to your heart sounds, but I want to mark your valves first, okay? All right, so on your right sternal border, right below at the second intercostal space, is your aortic valve, okay? Directly across from that, second intercostal space on the left sternal border is going to be your pulmonic. Okay, at the third intercostal space on the left sternal border is your Erb's point. Ooh, you're going to be mad at me if I rip off that hair, aren't you? Fourth intercostal space on the left sternal border is your tricuspid. And then mid-clavicular line at that fifth intercostal space is actually your mitral. Okay. Now, when I listen to your aortic and your pulmonic, I'm going to hear the second sound of your heart, which would be the S2. It's going to be louder than S1. When I listen to Erb's point, they're going to be equal. S1 will equal S2. And then when I listen to the tricuspid and the mitral, the first sound, which is the S1, is going to be louder than the S2. Okay? I'm going to listen with both my diaphragm and with my bell, so that I can make sure that you don't have any kind of heart murmurs or any abnormalities, okay? First I'm going to listen with my diaphragm. No heart problems or anything like that, Brian?
No.
No hypertension, anything like that?
No.
Okay. Okay, just relax. I'm just going to listen. Okay. Now I'm going to listen with my bell just to make sure that you don't have any kind of murmurs, okay?
Okay.
Sounds great. Nice and healthy. Sounds like you do, take good care of yourself, work out. Okay. All right. I'm going to check your pulses. We already checked your temporal, and I've already checked your carotid. So the only ones I have left to check are, I'm going to check your brachial. Check on this one. Wow, Brian, all the students need to check your pulses. And check your radial. Nice and strong. Check your radial here. Okay, your popliteal, but we're not going to check those today. And then I'm going to check your posterior tibialis. And check your pedal. And you have good pulses, Brian.
Good deal.
All right, looks good. Okay, just stay there for me. I'm going to look at your abdomen. And stay laying, get kind of comfortable, sorry. All right, I want to just inspect. Again, I'm going to stay on this left side so that I can inspect it more easily. Again, I'm going to get down. Notice that that your abdomen is very flat. Actually, no pulsations or anything like that, so that's good too. I want to listen to your vowel sounds. I'm going to divide your abdomen into 4 quadrants, actually, okay, using your umbilicus as a reference point. So I'm going to go 4 quadrants. This up here is going to be your right upper quadrant, your left upper quadrant, your left lower quadrant, and your right lower quadrant. Okay? And I'm just going to listen. Keep forgetting to turn my stethoscope back. All right. Brian, are you hungry?
A little bit. I'm always hungry.
You have nice active bowel sounds in all 4 quadrants. Okay, now I'm going to listen to your abdominal arteries. Okay, first one I'm going to listen to is your aortic, and I'm going to do that with my bell. Okay, I'm going to listen to your renal. All I hear is bowel sounds. I'll listen to your iliac. Okay. And then you do have femoral as well, but we're not going to listen to those today. Okay? All right. So the reason that I was listening to the arteries is because what I was checking for was bruits. If you were to have any kind of like an aortic aneurysm, I would have heard a bruit, especially in the aortic area of your abdomen. And it's just turbulent blood flow is how they describe that. So it had been very loud and kind of like, sounds like wind sometimes.
Okay.
So, okay. All right, so the next thing that I want to do is I'm going to percuss, okay, your abdomen. Let me know if you feel any kind of discomfort. I'm going to do that in all 4 quadrants. Okay. All right. I'm going to percuss your liver borders. All right. Use your umbilicus as a reference point again. I'm going to come out to the side. And what I'm going to do is I'm going to percuss until I hear the sound change. Okay. This is actually the bottom of your liver.
Okay.
Okay. I'm going to come up here and I'm going to come down to your 4th intercostal space. Okay, and I am going to, there we go, and I'm going to percuss back down. Okay, and I stopped when I heard that sound change again. So your normal length of your normal liver border should be 2 to 4 inches or 6 to 12 centimeters. Okay, so we're going to measure yours. Okay, and yours are actually 7.2, so that's good. Okay, all right. So we've gone ahead and now they've got all this tape over you. I apologize. Now that we percuss, now we want to go ahead and we want to palpate. Okay, so I'm going to real lightly just palpate. Okay. And then we're going to do some deeper palpation, making sure that we've gotten all 4 quadrants again. First I want to, before I do deep palpation, I'm going to go ahead and I'm going to palpate to see whether or not that I can feel your liver. Okay. Sometimes you can feel the liver, but it's not uncommon for you not to. So just lay flat for me. We're going to lift your back up just a touch. There we go. Okay, now lay back on. All right, so what I want you to do, Brian, is I want you to take a deep breath for me and hold it. Okay. All right, and now I want you to let it out. Okay, I didn't feel anything except for muscle. So let's go over here on this side and let's feel the spleen. Okay, take a deep breath for me again. Okay, and let it out. Okay, definitely didn't feel the spleen. We don't ever want to feel the spleen. If we feel the spleen, then it's possible that you could have an enlarged spleen, of course, and that may be indicative of mono. Okay, all right, so we're going to finish out with, we're going to do some deep palpation. Okay, again, still no discomfort or anything like that. Okay, all right, very good. Okay, now you can sit up for me. All right, that's the end of all the bad tasting stuff and everything like that, okay? Now I'm going to check your neurological status. I want to make sure that you are what we call alert and oriented, so I'm going to ask you to state your name for me.
Excuse me, Brian Kirby.
Okay. Can you tell me where you are, Brian?
I am at Dr. Outlaw's nursing building.
Okay, my nursing building, I like that. Can you tell me what day of the week, what time of the day it is, Brian?
It is Thursday, possibly 5:30, 6 o'clock.
Okay, very good. Okay, so you're alert and oriented. Now I want to do some tests just to check your memory, to make sure that you're not having any issues with memory, which you don't think you are you? Not any unusual? Okay. All right, so I want to check what is called your recent memory. So in order to do that, I am going to give you 3 words. And I want you to remember these 3 words. I'm going to ask you them again later during the assessment. Okay. All right, the words are black, white, and dog. Okay. All right, now, I want to assess your present memory, so can you tell me who the President of the United States is?
Obama.
Okay. And I want to assess your past memory, so can you tell me when your birthday is?
June 24th, 1985.
Okay. And I happen to know that's true because it is the same day as my son's, only a few years earlier. Okay. All right. Now I want to check your ability to make judgment and your abstract ability, abstract thinking ability, okay? All right, so I'm gonna ask you a couple of questions, and there's not a right or wrong answer to it. I just want you to tell me what comes to mind, okay? All right, if you were in a burning building by yourself, what would you do?
I'd probably leave.
Okay, all right, that's testing your judgment. We hope that that's what you would do. All right, now, I'm gonna say a phrase to you, and I want you to tell me, what does it mean to you? Okay, if I say, the early bird gets the worm, what does that mean to you?
You get up early in the morning, make it to where you need to be on time.
All right, very good. Okay, now, can you remember what those words were?
Black, white dog.
Okay, I'm glad you remembered because I actually had already forgotten, so. Okay, now, so we know that, that you're alert-oriented, that your thinking capabilities are intact. Now we want to check some of your cerebellar and your sensory functions, okay? There are actually 5 different tests that we check to make sure that your cerebellar functions are intact. 3 of them are general. 1 of them was assessing your gait, which I saw you do when you came in. You walked straight, no limping. You didn't act like you were having any kind of difficulty or pain with that. We've already done the Romberg test. That assessed your equilibrium and your balance, so that's the second one. So I have 1 more for you to do. I need you to stand up for me. And just because I know that you're athletic, I'm going to make you do the hard one. So I need you to do a deep knee bend for me. Put your hands out and do a deep knee bend for me. Very nice. Okay. All right. So that's our third one, our third general. Now, we want to do 1 upper body test and we want to do a lower body test. So the upper body test that I want you to do is I'm going to put my finger up and I want you to, with your finger, to touch mine wherever I have it. Okay. Okay, all right, very good. All right, now the one lower body that I want you to do is I want you to take 1 leg at a time, get your balance, and I want you to take the heel of 1 foot and I want you to run it down the shin of your other leg. I want you to do that with both legs. Very good, okay. All right, so your cerebellar functions are all intact. You can sit back down and we're going to do some sensory tests. Okay? There's actually several tests that we do for this too. There's 5 tests for this too. 2 of them are sensory and 3 of them are what we call discriminatory. So the first one that I want you to do is I'm going to get you to close your eyes, okay? And you're going to feel a piece of cotton or something very soft on your face and on your arms and your legs. And I want you to tell me, just say yes or I can feel it, whatever, as soon as you feel it when I touch you, okay?
Okay. Okay. Yes. 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 Yes.
Okay, all right, kind of hard to do the sock on. All right, okay, so that's called soft touch. Soft touch actually also assesses cranial nerve number 5, which is our trigeminal nerve, okay? Just want to get you a piece of cotton up there, apologize. Okay, now the next thing that we want to do is called sharp and dull. So I want you to close your eyes for me. Okay, I'm going to touch your hand, and what I want you to do, this is going to be sharp, okay, and then this is going to be dull. Okay, so I just want you to tell me if you're feeling sharp or you're feeling dull when I touch you.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Dull.
Scared you're going to hit me if I do sharp 10 more times.
Sharp. Sharp. Sharp.
Oh, and I just said I wasn't going to do that, didn't I?
Cool.
Okay, very good. Okay, so,
Fragile.
yeah. Okay, last thing that we're going to do are called discriminatory tests.
Okay.
So what I need you to do is I need you to close your eyes for all of these. Okay, the first one that I'm going to do is actually called stereognosis. And I'm going to place an item in both of your hands, one at a time, and you can roll it around in your hand however you want to, but I need you to identify it for me. Okay, and it doesn't have to be exact, just give me a general idea about what it is. Okay, so put one of your hands up for me. Okay, put that in there. Just tell me what it is.
Key.
Okay, all right, let's do the other hand.
Quarter.
Good. Okay, That's the diagnosis. The next thing that I want to do is called graphesthesia. So I need you to keep your eyes closed for me. And what I'm going to do is I'm going to get you to put your hand up for me. And I'm going to trace a number in your hand. And I want you just to tell me what number it is that I'm tracing, okay?
4.
Okay. All right, I'm going to do the same thing in the other hand, only this time, instead of a number, I'm going to do a letter. Okay.
Do it again. A.
An A. That's right. Very good. Okay. They're really not as easy as you think.
Exactly.
So.
Back over there.
Yeah. Okay. The last one that we're going to do is called 2-point discrimination. So what I want you to do is I want you to tell me whether you feel yourself being touched with 1 point or with 2. Okay? All right.
2. 1. 1. 1.
Sorry. Trying not to make you laugh.
2. 2. 1. 2. 1. 2. 1. 2.
Okay. Very good. All right. Okay, that is it as far as your neurological. The last thing that we have to do is we're going to check your musculoskeletal. Okay, so what I'm going to get you to do for me, Brian, is I'm going to get you to stand up. Okay. Again, part of making sure that that you have a healthy musculoskeletal system is I've already watched you walk in. I noticed that you stand very straight. So the next thing I'm going to get you to do is I am going to get you to bend over. And just touch your toes because I want to examine your spine. Okay, your spine's nice and straight, no pain or anything like that. Okay. All right, you can stand back up. Okay, so I've already looked at your posture. Now I just want to look at your joints. Just looking at them, don't notice that there's any abnormalities as far as them being uneven. So I'm going to palpate. I'm checking as well as checking your joints. I'm also checking your muscles, and I'm checking them for size, symmetry. Okay, your hips.
Yeah, one by one.
Okay. All right. You can sit back down. Okay. So we've already looked at your gait. We've already looked at your joints. We looked at your spine. Now I want to check your range of motion, and I'm going to check your muscle strength as well. So I'm going to give you just some real simple things to do. What I want you to do is I want you to take your hands and bring them straight out for me. Okay, bring them to the side. Just bring them up over your head. Bring them back down to the middle. Bring them down to your sides. Cross them. Okay. Now I want you just to take your hands, your arms, put them straight out, and I want you just to rotate your wrists for me. Okay. No pain or anything with that, right? Okay. All right, now, your legs, I want you to do one at a time first. I want you to extend them one at a time as far as you can. Good. Back down, second one. Now I want you to do them both at the same time. Okay. I want you to lift them both up and lift your knees up, straight up. Okay. All right. Now I want you to point your ankles. They're just balance too. I want you just to rotate those ankles. Okay, now I just want to check your muscle strength. So I have already looked at everything, but I'm going to use some resistance. So let's keep in mind that you're a little stronger than I am. What I want you to do is I want you to put your arms up like this for me. Okay, and I'm going to push against you, and I want you to push back against me. Okay, all right, very good. All right, now I want you to pull. Okay. All right, we're going to do the same thing with your legs. All right, just put them, relax them. Okay, now push out. Okay, now pull back. All right, very good. Okay, you almost pulled me right off. Okay, so that's it, really. I want to run through the cranial nerves one more time just to make sure that we got all of them. Okay, cranial nerve number 1 was your olfactory, which we checked with your smell. Cranial nerve number 2 was your optic nerve, which we checked with the Snellen chart and with the Rosenbaum test. Cranial nerves 3, 4, and 6 we're checking. We checked with your vision as far as doing ocular motor tests, with doing the age test, and with doing your visual fields. That was ocular motor, trochlear, and your abducens. Okay. Number 5 was actually your trigeminal. We did soft touch with that, and one thing I forgot to do is I wanted to palpate your temporal mandibular joint. No problems with TMJ or anything like that, Brian? Okay. All right, cranial nerve number 7 was your facial nerve, which we checked with the taste test. Cranial nerve number 8 was vestibulocochlear, which we did with balance. Cranial nerve number 9 was your glossopharyngeal, which we also did with the taste test. Cranial nerve number 10 was your vagus, which we did with the gag reflex, and we also did with swallowing. Cranial nerve number 11 was your accessory nerve, which, and I forgot to do that as well, is we want to do your neck muscles. Okay, so what I want you to do is, I want you just to push your head against my hand, okay, on this side, okay, and back, okay, and forward, okay. And we'd already done the shoulder, try to do it one more time for me, okay. All right, so that's cranial nerve number 11, your accessory. And then cranial nerve number 12 was your hypoglossal, which we did with sticking your tongue out, back and forth, and with the tongue strength. Is there anything else that that we need to address today while you're here? Everything looks good as far as being nice and healthy for sure.
I'm good with that, Caroline.
Okay, all right. I appreciate your coming in.
Thank you.
All right, thanks, Brian. Okay.